Stop guessing when you treatment plan and start systematizing with a dental facial analysis. Shout out to John Kois. After doing the 4 required photos to properly do this with the Kois 2.0 glasses, then you can send it to Evident Digital to get the DFA. And this is how I use it. Step 1, the maxillary cuspid position. This takes into account the right maxillary cuspid in respect to the lips at repose. This number on average is anywhere from -1 to 1. Most people use the central incisor, but if you look at the studies, it can be a bit more variable depending on lip form and a few other things. In this case, her cuspid is at -1.7. So that means 1.7 millimeters above the lip in repose. So if we think about the averages, we can actually add 0.7 millimeters and get within the average. So what are we going to do to treat this? Well, we can obviously do restorative to gain length. But what happens if that number is greater than 2 millimeters? Well, then the patient will be at risk for vertical maxillary excess. And then you have to start thinking about orthognathic surgery or a few other things. Step 2, maxillary lip dynamics. The second step is analyzing the maxillary lip dynamics. And what this looks at is the Duchenne smile compared to the repose. It measures the distance from the repose lip to the Duchenne lip. And this average number is typically 6 to 10 millimeters. In this case, the patient had 11.6 movement, which is a slightly hypermobile lip. Treatment to reduce lip mobility can include Botox or potentially lip repositioning surgery. In this case, we're not going to really bother because she's so close to the norm. Step 3, tooth measurements. The final step analyzes the tooth proportions. The average visible length for a number 8 central incisor is 10 millimeters. This patient has a visible tooth length on number 8 of 7 millimeters. So if I told you in step 1 that she had -1.7 and we're going to add 0.7 millimeters downward, now we're at 7.7 millimeters. So maybe we have to go up a little bit, maybe 1 millimeter, maybe 2. Now, all of these averages are supposed to be taken into account for each case. Maybe we're not going to go for that 10 millimeter length central incisor for her. Maybe we're going to go for 9. Treatment at this step will depend on the diagnosis, whether it be a just a simple gum lift or crown lengthening. Remember, altered passive eruption. All in all, this was a fun case. This included crown lengthening from tooth 2 through number 15. This also included 3D printed no prep temporaries, and then finally porcelain veneers and crown for the full upper arch. This is what it looked like. This is definitely a simplified version of the entire system that I use, but it is a good start for you to get into facially generated treatment plans. Again, shout out to Dr. John Kois for teaching this to me. If you want to learn a little bit more about this, I do teach my version in my online courses.